This is an unprecedented time in our country that we get a chance to serve on something that is greater than ourselves. We serve our country.
The reason why Task Force Southeast is highly important within FEMA Regions 3 and 4 is because if a state does not have the capabilities to continue with the fight against COVID, the spread is going to continue. That is when the request comes to Task Force Southeast, so we can augment and support each state to make sure that we actually stop the spread and actually flatten the curve. Public health is all about preventing and keeping people healthy.
My biggest task here is to ensure that any personnel that we have leaving the task force to go support the mission assignments in the other states are prepared. We want to make sure that when they get back that they're monitored, and because they're mission essential personnel, they still need to come back and do their jobs, but we also want to make sure that they don't bring back anything that they were potentially exposed to. So that's really a big part of my job, is to monitor the health of the task force. Also ensuring that they know what their resources are when they get back. It could be a risk to the task force personnel who didn't leave. So we're pretty much just trying to mitigate any COVID-19 risks to our personnel here and going out. Making sure that early identification happens so that anybody who could potentially be a risk to the task force is temporarily removed. We ask that they go seek medical care over at the 20th Med Group here at Shaw. You hope for the best, plan for the worst, but the hope is that in screening people daily and that folks actually take some responsibility too for self-monitoring.
We all have to do our parts to keep each other healthy.